Good day, everybody. Welcome back to the Deal Scout. On today's show, we're going to have a conversation with my friend Justin. And you may have heard a little bit of his story on capitalist culture with Kip, but we're going to dive a little bit more into the world of deal making in this story. So, as always, all the contact information of our guests will be in the show notes. Reach out to them and say thanks for being on the show. Connect with them and find a way to support their work or do a deal together. But let's dive in. Justin, welcome to the Deal Scout. How are you today, man?
Doing well. Thank you for having me. How are you?
Yeah, man. We were talking in the green room prior to hitting record, and we're both like, man, we've got a lot of stuff going on, and we wanted to share the story and all the stuff of what we've got going on with the community, so we could all learn and go, grow together. But man, I wear a lot of hats in the world that I'm in, and I'm trying to narrow down the hats that I wear. And if we look through your story, you've worn different hats and you've come through different industries to land to where you are now. So why don't we kind of start where we are now and do Quentin Tarantino and work back to how you got into the world and the different hats that you wore.
Yeah, so my training and background is a certified public accountant. An accountant, boring numbers, don't have a personality. And, the stereotypical accountant is the person that you could put in a closet and lock them and they'd be just fine as long as they have, numbers and little office, little desk to have
An
and,
abacus maybe or some spreadsheets, you know?
yeah, spreadsheet or, Excel files or a calculator, that
Yeah.
kind of thing. And, for me, the reason why I became an accountant or trained in accounting is I was talking to some business owners because my dad was a business owner in the furniture parts world, secondary market, and we were on a hobby farm. He always had business people coming to the house and talking, and all these different business owners. And I asked them, kind of, well, what do you do and how do you do it? And all different backgrounds. But the one thing that they all had in common was the language of numbers and how numbers transcend everything. And one of my dad's friends had his own CPA firm. And in that CPA firm, he said, if you want to learn a lot of businesses, become a CPA. You'll see a lot of businesses, and that might not be what you want to do, but it will at least help guide you to see what you might like to do. And I started off in actually 2009. So I got my 4 year degree in 3 years at Simpson College, accounting, economics, and marketing, triple major. I got out in 2009, worst time ever to start in the finance industry because, it's the recession,
Hmm.
no one's hiring. I almost joined the military because in the military, they're hiring.
Yeah.
And my father was a Vietnam veteran that was from the Navy, and he was actually of all people a cook. And he said the fact that you have a 4 year degree, the military would be a very good place for you to go. So I almost signed my papers to pursue that, and God had a different plan for me, but I ended up joining a CPA firm, and I sent out 150 resumes, 20 interviews, one job offer.
And you took it.
Oh yeah, he took it and started off, and I was so afraid of failing or losing my job. I did all the work that I was assigned. I took on as much work as I could to try to be of value. And through making all the mistakes, and it was a small CPA firm that had auditing and accounting and taxes, so I got to see a bunch of different opportunities. And in that profession as a CPA, I got to see all of the facets that make up a business. And from doing all of that, I ended up meeting the professor at the University of Minnesota who started this crazy idea of gene editing in animals. And the idea was to one day make pig kidneys for human transplantation, which is now happening today. as they've been implanting, in New York, and there's a company called Makana, which came out of Recombinetics, and in that company we raised a little under $70 million for it. And I was part of all of those efforts. And the way that started was the professor said, well, I need to raise capital. And I thought it was a cool idea. And I said, well, I think I could do that. And I basically quit my job and joined this professor at the U. And that was the start of the journey.
So wait a second. So you got this job as a CPA. You saw it was a small shop, so you were doing audits, taxes, filings, all sorts of stuff. Were they primarily private, or were there any public?
No public, all private.
Okay. So you're seeing firsthand, owners bringing shoe boxes of receipts, and here you are, you've got to put all those taxes together and figure that out. And then you get this opportunity that came across a plate. You met the professor, and they're doing gene editing for animals. And he says, would you like to go raise us money? And you go, sure. And you quit your job. What in the world was like, what kind of conversations were you having with your dad, or maybe your employer, like going from the most secure kind of role, like a CPA, to raising capital for maybe a startup? Was it like that's a big jump for you? What was going through your head?
I wasn't really thinking. I just did it. And
Just did it.
it was my scariest thing because I talked to my folks, and my parents are very entrepreneurial, so
Yeah.
they were very supportive, and I have to give them a lot of credit for that. But it's one of those things where it's like you have to jump and take the leap.
Yeah.
And like if you don't take the leap, you're always gonna regret. And I can't live my life that way. I have to live it from a perspective of always pushing, always going for it. And at the end of the day, if I put everything on the line for what I believe in and put everything into it and I fail, I can be okay with that. But if I hold anything back, now I'm entering into a realm that I don't want to pursue. I don't want to be in that void of, well, what if? I don't want a what if. I want to be able to say I did it and I pursued something with all my passion and abilities, and also learning how you need to have the professionals, you need to have the different people of skill sets to really build something.
Yeah.
Because, in the world of being a CPA, you are willing to work with a lot of different facets of people in a business to get to the end result. And you don't necessarily like everybody you're dealing with, but you do what you have to do. You be a professional and you move the ball forward.
Yeah. On the disc scale, I don't know. Have you ever taken the disc scale, the
I,
DISC?
long time ago, I think.
Do you remember which letter you were?
I don't.
Okay, no worries. Maybe you could come back to us. I'm always like interested in like how a person's wired and how they go about making the decisions that they make. So your family were entrepreneurs, and you got into a job that was super clockwork, right? But heavy work, and you were doing the work of multiple people, and then you see an opportunity to raise some capital, and you guys wound up raising just under 70 million. Now, for your
Yeah.
first at bat, for your first time raising capital, that's a significant amount of money for raising capital. Do you think that not having a background in raising capital gave you the ability to just go, I guess it's possible, I'll go do it, and you did it? Like, or do you think, like, how did you approach that? Do you understand the question, like, I'm trying to pose here?
I think I do, but I'm a little slow and sometimes I need to hear things multiple times. But the reality of it is that, yeah, I think not knowing the failures, not knowing this VC world, the private equity world, I mean, I had no fear of failure. I had no fear of talking to people. And what it comes down to was, I mean, I was trained early on by my dad, who said, anything you do, you have to put your own money behind it and put everything into it. And if you do that, then you can speak to people with authority about what you're doing. And that was the thing that I always had grounding me, is I was always at risk. I was always putting my own money in, my own capital. And, if you think about it, a lot of people today that fail have no capital exposure. You talk to these VCs or these CEOs of VC-backed companies, they have no skin in the game. And so when things get tough, you fold. I can't fold. If I fold, the company dies. All these things that we're trying to move forward die. And when you have no choice but to move forward, you move forward in the most creative way possible. And when you live under constant pressure to perform, it is amazing the amount of ingenuity and creativity and perseverance one can have.
Yeah.
And I think, at the end of the day, and this is the other thing that propelled me forward. So as terrible as it can be doing a startup, the hours, the politics, the people, all of the things. The thing that propelled me forward in the genetics company and now in Centrifuge is the human patient outcome. The I don't want, in that company, we did not want to have one person die of not being able to get a kidney transplant. And there's 100,000 plus people on the waiting list, and that's a terrible, terrible problem. And not one person should die if we have the technology to change that. Same thing on the pain side. Not one person should suffer from debilitating back pain after a successful spinal fusion surgery or any spine procedure, because we did not utilize the most advanced technology to move the ball forward. And that's what propels me. There's over 50 million people from chronic low back pain. Millions of procedures are done. 1.1 million done annually every year, 600,000 for fusion patients. And you have this problem of opioids. And you have this scourge on this earth, which is where we have no choice but to treat opioids, treat that problem with opioids to help these patients recover. But the sad truth is, a lot of times these patients don't recover, and they go down this long addictive path of more opioids, more procedures, and maybe if they're lucky, they get a stimulator implanted. But that doesn't happen unless you're very proactive. And you have the way society is set up with the payers, with big pharma, with big med device. You are not really encouraged to innovate. You're encouraged to do the opposite. And I refuse to live in a society or in a country where we do not push the boundaries of what is possible. And look at what Elon Musk did with Tesla, and now recently with SpaceX. If you didn't have that kind of thinking, you wouldn't have electric vehicles like we have today. You wouldn't have rockets going into space like we have today to advance civilization. And I look to guys like that as inspiration, because when you're trying to change a paradigm or shift a paradigm, you have to think big and you have to be willing to go through the sacrifice to make it happen.
Yeah, for sure. So you started to describe where you're at now with Centrifuge, right? So you raised money for the first company, but you've also raised money along the path, through other channels or for Centrifuge. Can you talk to us about your capital raising? Maybe give us an overview of what you've accomplished in cap raising, and then I want you to explain what Centrifuge is, because you alluded to it in this description, but this is where you're at now, and you're building this, and it's really interesting.
Yeah, so the capital raising has really been very simplistic. It's been individuals, people from my network and from their existing network, who have a passion, want to see something change, and are willing to take risk. And that's how we started to raise the money in the first company. And now in this company, the same thing, only in this time with this company, we're utilizing also now broker dealers.
Mhm.
And we're going through the Reg D and all those compliance issues that you have to do. But we're going to also RIAs, now family offices, and we have to expand the network because it can't just be my network. It has to be beyond the network. But to start it, it was our network, our friends and family, and people that believed. And we started by talking about the idea, about the problem, and then putting our own capital behind it. So I've led every round. I've led this round with $900,000 in our Series A and 2.5 million of total exposure. And that doesn't happen just by you know by happenstance. It's by full concentration and putting everything into it, and having a lot of naysayers, a lot of people saying, well, you can't raise capital, or a VC. I remember one VC, well, you can't get this paid for. And it's like, you're telling me that if we end up changing lives and making people having better outcomes, pain outcomes, you're telling me that we're not going to be able to move this forward? Like
What?
crazy things like that.
Yeah. So I understand the mission and what you guys are trying to accomplish, and you put your own money in it. You believe in this fully. Why do you think the VCs were so resistant to what you're trying to work on?
Well, it could be me. I mean,
It's
I'm
possible.
I'm not a VC guy. I'm about and again, I have Midwest values, so honesty, integrity, doing what you say you're gonna do, and getting outcomes. But I can't really speak to it other than I want to do fair deals. I want deals where we all make money together. A lot of times when I hear about VCs or private equity, there's a win-lose. I believe in the win-win or the lose-lose. Like if we're going to make this thing happen, we're all going to win together. And if it's not going to happen, then we're all going to lose together. But not one person benefits and the rest don't.
Hmm.
And I think a lot of VCs structure things in a way to not help, but to kind of get you, or they want to get a deal, and it's like, well, if it's good enough for me, it should be good enough for you.
Interesting. So your background in as a CPA has geared you up and prepared you, which most founders do not have the background to understand, you know, future, understand now, understand financials. That's something that most founders have to work really hard at. When it comes to your role at Centrifuge, how do you believe your background, raising capital, CPA, how do you think it has prepared you to do what you do today within the team?
So that's a really, really good and tough question.
Yeah.
I would say that being a CPA has allowed me to being able to read numbers, focus on numbers, and how do numbers and returns impact individuals who are taking risk, but also how can we build equity structures, which I learned early on with options and restricted stock, and how do you align your shareholders with your executive management team, with your board. A lot of times you will see in different companies, certain shareholders will have preferences and rights, which are at such an extreme advantage that why would someone want to take the risk with you if they can't get those same rights or get better rights?
Hmm.
And so by understanding that dynamic, what I've done here is I've structured things in a way where everybody's taking risks together. So the shareholder benefits as the management team benefits and as the board benefits, and it's all aligned. By having those vertical alignments, you make it where everybody is working for what's best for the company. And a lot of times you don't see companies fully trying to return shareholder value. And in our company, it's even more unique because I want shareholder value and I want patient value. If shareholders are doing well, patients should be doing well. They should be aligned. And you don't see that today. With a lot of the big companies, patients are in this terrible continuum of additional surgeries, additional pain, additional therapies trying to navigate, and everybody suffers, but people are getting paid and people continue to be in this cycle. And we're focused on getting out of that cycle.
Okay. So centrifuge, explain what centrifuge does, explain what it is, and then how are you breaking that cycle?
So Centrifuge is a medical device company that has novel technology focused on the integration of stimulation with spinal surgeries. In particular, our first clinical feasibility trial was 15 patients in single and two-level fusions patients that were indicated for a fusion for first time. They had chronic low back pain and leg pain. And what we've done is we are innovating the way that technology that used to be stimulation used to be just for the pain physician. And what we're doing is we're making it designed for the spine surgeon. And by doing that and working with the spine surgeons and having our chief medical officer, who is a top neurosurgeon who does spine surgeries at mHealth Fairview, we are really innovating and pushing forward the boundaries of what was thought as possible. And we're taking two existing technologies, combining them in a new way that really helps deliver on what we're trying to do, which is advancing the ability to treat chronic pain up front at the first surgery. Not multiple surgeries, but the first surgery. And I have to be very careful here, but early data that we're seeing is very encouraging for us, which is propelling us forward with getting more doctors on board, more people coming to the table, and we're innovating in an area that should not be possible to innovate right now. Medtronic should own this space right now. They don't. Abbott should own this space right now. They don't. Boston should own this space. They don't. They don't because there is no codes for what we're doing. There's codes for fusion, there's codes for stim, but never have the two been integrated because, well, who would pay for that? Or the idea of, well, you get a person to, you mechanically fix them here, and if there's more things, well, then maybe later we'll fix them with stim. But the worlds are so far apart, it's like, why wouldn't we combine them to move everything forward? And that's where, with the company, we were created because we had a neuroscientist, a pain physician, and a neurosurgeon coming together with a businessman, myself. And here I am, the guy who is the least qualified out of anybody, saying, well, why haven't we done this? Well, we haven't done it because of money. Well, that's a ridiculous notion when you have up to 40% of these patients that are getting these spinal procedures done that are having chronic pain. And you got $20 billion a year annually that's due to failed back surgery syndrome. And you got 1.5 trillion with a T, $trillion on opioid misuse in the United States alone.
Man. So you're taking the innovation of is combining, and the big companies are missing it because of a code, right, to get paid. Potentially, I don't know. I'm just trying to reframe how I see it. And but combining this and this, you can now do it, but they're gonna have to, the insurance companies, the doctors, the hospitals will have to figure out what that code is so in order to be compensated or to be reimbursed or to pay for this stuff. And is it somewhat, I don't want to say a simple fix. Uh, is it a, I guess, would a simple fix be do these two together and this is our synergy. This is our centrifuge. This is what it does. Is it a pretty simple complex or concept?
It's a very simple concept, and it's a concept that oftentimes gets missed because it's so simple, so straightforward. And that's why we have to do this big national clinical trial. The next step is to prove it out, to have, the control group, which is today's standard of care, which is fusion alone, and it's to show on a national scale that, hey, when you do our procedure, you have a better outcome. That's what we have to prove. That's what will then help us get a code. That's then what's going to help us get to that next level.
Now, what's to stop, being a deal guy, being the businessman, what's to stop Medtronics or Boston or one of these other groups from, you guys are paving the path. What's to stop them from just scooping in and accelerating beyond you?
So we have several protections. One, our biggest protection is we have lots of intellectual property around the world. In North America, over 80 patents. There's going to be even more patents. We have the key opinion leaders from both the robotic side of the spine world and the neuromodulation side of the spine world. We have combined the best and the brightest, and I mean this, the best and the brightest that Medtronic and Abbott currently are utilizing, and Globus are utilizing, and they are the chair and the vice chair of our medical advisory board with our chief medical officer, and we are combining all of that with the expertise that we have that laid this foundation of the patents. But then the other piece is because of how we're doing it, the time and place, we're a class 3 device. You can't just 510K. You'd have to repeat the same trials that we did. However, you're going to run into IP. But then, even if you go to, let's just say they wanted to start, some of these big companies, it'll take them about 10 years before they could even come close to getting through to what we're doing. And they have to navigate around our IP, get a device, and we're taking all of the learnings that came from this feasibility trial. We're putting it all into our own novel proprietary device, which we're building based on that data. And again, the big companies, they cannot, like Medtronic, if you're under half a billion dollars, you don't exist. It doesn't exist. And, if you think about that, how many innovations have we seen? And most recently, you see innovations from the Inspire Medicals of the world who were spun out of a Medtronic because the revenue didn't seem to be attractive. And now they're north of 500 million in revenue. And that's for sleep apnea. That's a novel device, a novel approach going directly to patients and to doctors and connecting them. And I see a lot of parallel paths for centrifuge because there is, when you go and you need a spine fusion, you go to a doctor. If you need to get a recommendation on what procedure, you go to 5 doctors, you might have 5 different responses of what to do, different procedures to do. We're standardizing an outcome or a procedure to address that problem. And if you're a patient and you're looking at getting your back solved, I mean, the back is very complicated. You talk to our chief medical officer and our other surgeons that are on board, spine surgery is complicated. It's not easy. It's not straightforward. And, these geniuses, these guys who have to take their hands and make something happen are making these patients better, but the tools have been limited. It's our job as centrifuge to bring forward the most advanced tools to help them move forward. And it's a tall order because us as little guys were underfunded, overworked, and the reality of it is we shouldn't even be here. However, we are here, and it's because we're all going for a better outcome for our patients.
So Justin, as you're, oh, you got a call. Hey, you made it. You won. So as you're building this out, Justin, what does the future look like for you? You've been a part of some great businesses. You've parlayed from CPA to the world of startups and founders and raising capital. Like, what does the future look like for Justin?
The future that I see is building a top class medical device company that pushes innovation forward and makes it where more patients are getting better outcomes. And those better outcomes are leading to a better society. That is my mission and goal no matter what. We have to move everything forward, and if we don't move everything forward, it's not going to happen. And we owe it to ourselves, we owe it to our shareholders, we owe it to our patients, to our doctors to advance everything. And in the end, my goal is, how do we get opioids out of this process of spine procedures, and how do we get people back to work, back to better lives, which at the end of the day, that's what it's about. How do we make things better?
Yeah. So the plan is with centrifuge, it could increase the healing process or help people not to experience much pain. Is that the real goal? So that way they're not dependent on opioids to deal with the pain and the healing process?
Yeah, it's to help with the healing process, it's to help with pain, it's to help all the above. Now, we cannot make claims, but the goal is to reduce pain and to reduce the biggest element which drives to opioid addiction, which is pain. If you're in chronic pain and you're living that every single day, people don't understand unless they actually have had chronic pain.
Yeah.
I've been fortunate enough not to have chronic pain. I had one time a flare up, and give me whatever drug you can give me to get me out of it. That's the way I'm going to view it. But if you deal with people that have chronic pain, they're not enjoying their lives. They are suffering, and we owe it to fix that and to strive. Today we should not be in a country where we're not advancing the most advanced technologies. We shouldn't be afraid of it because, well, there's no code, or how are we going to get paid for? We need to advance these technologies and get it to be paid for so we can move everything forward. And we want people to get back to their lives. We
Yeah.
want people to get their lives back. And nobody that I know wants to be on opioids. No one that I know wants to be dependent on a drug.
Yeah. Yeah, it is. It's a big issue right now. So for people in the audience who are interested in learning more about you and learning more about your company, where can people go to do that?
They should go to www.centerfuse.com.
Okay. And all that information will be in the show notes. Justin, are there any questions that I should have asked you during this interview that I completely screwed up and did not ask you? Because it's possible. I've done this a lot, but it's very possible I missed something.
I think you did a very good job. I mean, I've been on a handful of podcasts, and I mean, you've done a great job, and I think you asked a lot of good questions, and you kind of got to you dove into the questions, and the other thing too is at the end of the day, you have to have something greater than yourself if you're going to go through the pain and the suffering, and you hit on that. With the question you asked.
Yeah.
And if the problem's not big enough and it doesn't take a lot of people, then you're probably not trying to solve a big enough problem if you can handle it yourself. And that's like the goal of, I think, success is you have to collaborate with people. And, at the end of the day, I want to be able where if something happens to me, God forbid, people are still getting treatments and they're moving forward. And, you look up to the guys like Bakken who really moved the needle. And that's the goal.
Yeah. Well, Justin, I appreciate you coming on the show and sharing your journey. Fellow deal makers, as always, find a way to connect with them, follow them, connect with them on LinkedIn. His contact information will be in the show notes below. As always, deal makers, do your research, talk to your attorneys, your CPAs, your financial advisors before making any decisions. This show is for educational purposes. And if you have a specific deal or type of structure or company that you'd like to talk about here on the Deal Scout, head on over to thedealscout.com, fill out a quick form, and maybe get you on a show next. And until then, we'll talk to you all on the next episode. See you guys.